to honor the first AFCON, the first Africa rather, Health ExCon with his attendance. The first edition, it's going to start today, the 5th of June, and will continue for 3 days. Ladies and gentlemen, we are watching live footages from El Manara, where President Abdel Fattah al-Sisi arrived to witness the activities of the first Africa Health ExCon.
اجتاحت العالم في الفترة الأخيرة، ولكن استطاعت مصر بالقيادة السياسية الحكيمة أن هي تحقق خطى متقدمة جدا في مكافحة مثل هذه الأمراض من خلال الإجراءات الوقائية والاحترازية اللي اتخذتها الدولة المصرية. أيضا كان هناك شفافية في المعدلات الخاصة بأرقام الإصابات الخاصة بالفيروس وأيضا حالات الشفاء منها. أيضا استطاعت مصر أن هي تصنع اللقاحات الخاصة بعلاج هذه الأمراض وخاصة
these viruses and coronaviruses, the vaccines, and to export it to numerous African countries. And this has been proven by numerous medical international organizations, on top of which is WHO. Also, one of the many challenges was the coronavirus pandemic and the reform steps that's been taken to confront this pandemic, and how the Egyptian country has been able to do through the numerous economic reform by the Egyptian bodies has also enabled to mitigate the repercussions of the corona pandemic, especially the economic repercussions. But this also has helped to have a methodology in place which has focused on the importance of the medical sector and how to upscale and how to rely on the advanced technologies in that regards, where lots of physicians, researchers and scholars have been endeavoring their efforts to find a solution and to find a gate out of this pandemic that has threatened the whole world. And they are all gathered today through this African Health Exhibition Conference, where they are combined together to find numerous innovative solutions for combining their efforts and endeavors together. And for sure, this will have its own positive results on the medical sector and populations. For sure, this is the first of its kind ExCon that will witness the launching of numerous initiatives that will be presented through this conference, on top of which is the Women and Child Wellness Initiative, and to secure African Egyptian women. And in this regard, we will have also the presidential initiative for the treatment of spinal muscular atrophy. And maybe we have recently witnessed the Egyptian state providing treatments to numerous spinal muscular atrophy patients. Also, we'll talk about the tourism health, and maybe lots of countries have been already directing their attention to this kind of tourism due to the increase of demand, and for sure due to the great industrial revolution impact. And as you know, Egypt does have lots of resources and the privileges with the mining resources that help in this kind of tourism, and this is why we attract numerous tourism from all around the world. And also Egypt does have numerous resorts that also help in providing this kind of tourism. Also, let's talk about the significance of this African Health ExCon that is hosted by Egypt. This conference will promote and showcase the Egyptian leadership and role in Africa as it comes in line with the Egyptian strategy, in addition to its participation in executing the Egyptian and African steps in regards to the infrastructure of providing the medical services provided to African citizens. Also, this conference, which combines all of the health representatives under one umbrella to provide a unique opportunity to explore what could be provided in numerous related and concerned centers And in this framework, Egypt has also been held by this conference towards being one of those transformational hubs to provide all of the recent technologies in numerous medical sectors in African continent. Meanwhile, the African-Egyptian ties are historical and persistent, and Egypt has been able through the past 8 years under the leadership of His Excellency the President Abdel Fattah el-Sisi to retrieve its role in the continent of Africa, to get back its political and economic role, and to also construct the common phase and to help development of the African continent. So since his chairman of the position, Egypt has been able to provide numerous success in the numerous sectors, for sure also the Egyptian securing sector. So the African Health Exhibition Conference in its first edition does have a significant role, especially in line of His Excellency's guidelines and his keenness to auspice this conference and his presence. So this helped the conference to be having a significant regional and international role, as it's become now an African gate towards innovation and trade, to become a conference between all of the world experts, especially the African medical experts annually. So we will have presentation for the recent technologies and what the medical companies have been provided recently for the sake and interest of the medical sector. It also provides a unique educational opportunity where we have all of the researchers and scholars through the numerous researches provided and workshops for the sake of humanity. So Egypt has always taken the proactive steps in this specific regard, and we've taken very rapid and relentless steps to retrieve our strategic role in the African continent and to get back to the old track, especially in terms of the collaboration between Egypt and Africa in the medical files. We have also got lots of building capacity protocols for the young physicians and to have scholarships in the African countries. Also, Egypt has helped numerous African countries to send numerous vaccines, especially the coronavirus vaccines. We have also witnessed support to send the numerous medical convoys in numerous medical specifications to the numerous African continents. Africa Health, which is the main scope of this conference, and the continent access for innovation and trade in Egypt and Africa, organized by UPA, the Unified Procurement Authority, and the Medical Technological Managing Authority, does play its pivotal role in the development and to follow in the recent advancements on the global arena in this medical and health sector, which showcase its significance recently, especially with the outbreak of the corona pandemic and also some other diseases that our researchers and scientists usually try to find solutions for. And as been stated before, also the cervical cancer is one of the main files that has got great focus through numerous researches to maintain the wellness of our women and girls from being infected and subjected to this disease that may require a root cause elimination medication. Also, you were talking about also the treatment of spinal muscular atrophy. So talking about the numerous diseases and that Egypt has managed in this sector to work on numerous researches and has become one of the role models in confronting diseases, and to have international acknowledgement from WHO and other World Health Organizations. Egypt has been able to confront the coronavirus, and in parallel, Egypt has also been taking relentless steps to defeat virus C. So Egypt has become one of the first countries to achieve its role in eliminating the viruses through the 100 million initiative, and His Excellency the President has been able through this initiative to provide free medications to around 2 million Egyptian citizens. His Excellency President Abdel Fattah el-Sisi, the President of the Arab Republic of Egypt. Good morning, welcome everyone. Please be seated. Your Excellency President Abdel Fattah el-Sisi, President of the Arab Republic of Egypt, ladies and gentlemen, distinguished attendees, allow me in the beginning to quote from Ahmed Shawqi, where he was describing our continent of Africa, stating, Africa is part of our existence, just similar to our decades. Yes, our continent of Africa has got this shape, but meanwhile, it has its strength with the linkage of its seeds, of its soils. And this linkage is proven not just through governments, but also through nations and populations, where we have the African population just hand in hand and shoulder to shoulder with all of their capacities to have our continent is the greatest of the universe. Maybe part of the fruits of this linkage is this conference, the first edition Africa Health ExCon, which is unquestionably the translation for the integration and for utilizing the capacities of our medical calibers to contribute greatly in minimizing the sector inside our continent. This is not just through the integrated of our medical calibers inside the continent, but has even got out borders with the collaboration of our FDI companies and those who are still having this passion to be part of investors of our continent. Subsequently, what we witnessed today is not just a health conference, it's just the seed for a fruitful future in the medical sector inside our great continent. So this conference is the main gate for the integration of medicine into our continent, and with the numerous languages and tongues, our African goals are still common. Now, I would like to call His Excellency Tubaha Zidan, the head of UPA, to state his opening remarks. In the name of Almighty God, Your Excellency President Abdel Fattah el-Sisi, distinguished attendees, it's with great honor to welcome you all in this unique event where the Unified Procurement Authority and the Medical Technological Managing Authority has hosted and organized according to the guidelines of His Excellency the President of the Arab Republic of Egypt guidelines in May 2021. These guidelines have included the coming that from 5th to 7th June 2020 to be regularly and annually conducted, and to call the conference as Africa Health ExCon. and to come in line with the Egyptian Vision 2030, which supports the African Union for development, and to be a dialogue hub between the African continental countries to share experiences, and to take into consideration collaboration with the world organizations to help put in solutions for medical issues on the African continental level, which comes in line with the African Union Agenda 2063 axis in its endeavor to provide SDGs for the African populations, which provides the main pillar of providing, securing wellness to African populations. And the UPA is one of the mechanisms adopted by the Egyptian government in the framework of developing the medical sector through playing its role in putting in place the medical technologies and promoting the governing measures in providing the needs and localizing the medications, and to provide the medical services according to the international standards, and to have equitable distribution to all citizens. And Your Excellency's guidelines to the UPA to have a strategic on securing the country in all of the needs of the medical supplies. In suppliers, medicines and laboratories have played great role in confronting Corona and to confront the Ukrainian-Russian repercussions that had greatly impacted the world supply chain. And one of the benefits of UPA to have the medical resources with best quality and least cost, and to be equitably distributed to the whole country through the governmental hospitals with the same exact quality that ensures the social equity to all of the Egyptian citizens, and with the increased demand globally towards regionalism, which has become a must, and particularly speaking between the African countries that have common history and common current situations and common milestones. The UPA has got a methodology that works on constructing regional relations, targeting, providing and achieving common integrated goals among the African people, particularly speaking in the field of medical suppliers and related industrializations. Undoubtedly, this Excon is the first practical steps towards achieving the objective integration, and it's a gate to showcase the African countries which promote the intertrade. Moreover, providing the attracting of numerous FDI in the health sector, which is the most growing sector among the economic sectors in the African continental countries. And here comes some of the current statistics that we have inside our Excon. Number of registered on the conference platform till this moment is 35,000. More than 350 local and global companies in numerous medical-related sectors, more than 800 speakers from all over the world, 280 sessions and scientific webinars, 24 scientific conferences, 20 workshops, accredited programs for the African and Egyptian trained physicians, and providing accreditation certificates from the UK Royal Surgical University. We will also conduct the greatest Cardio Alex in Alexandria from the 7th to the 6th of July for the medical specifications of this conference. And UPA wouldn't spare any efforts to have this successful conference to be a beacon for future and for more projects and ventures to upscale the national medical and health care required suppliers and systems. And lastly, I would like to pay tribute to His Excellency the Prime Minister and all of our ministers and heads of the governmental organizations, universities and Egyptian scientific associations and all of the participating companies locally and internationally, along with the organizers. I also would like to pay tribute to the African ministers of health and also the Arab ministers for their presence. And thank you so much for attentive listening. And for having full picture, and because the picture would give more impact than speaking, and because everyone looks forward to have scaling levels in Africa. Now let's see together this movie where we have focused on the health in Africa.
إفريقيا درة قارات العالم ومهد أول الحضارات. الأرض الحاضنة لما تبقى من مظاهر الحياة الحرة، وموطن لأكبر مزيج للأعراق واللغات والديانات على كوكبنا. تواجه قارتنا تحديات جسيمة فرضتها مساحتها الشاسعة وصحاريها الممتدة وعدد السكان الهائل وعقود من الخلل الهيكلي لإدارة مواردها بسبب الاستعمار أو التناحر الداخلي، وهو ما جعل منها موطنا لنحو 25% من الأمراض، والأكثر انتشارا للأمراض الوبائية والمعدية، والأعلى في معدلات الوفاة، إذ تستحوذ وحدها على نسبة 40% من إجمالي الحالات عالميا. وتظل قارتنا رغم هذه المؤشرات الخطيرة الأقل حظاً في عدد الأطباء، والأكثر عجزاً بالمنشآت العلاجية، والأشد خللاً في انتظام سلاسل الإمدادات الطبية. ورغم تحقيق العديد من دولها نمواً اقتصادياً مذهل، إلا أن معظم دولها الناشئة لا تزال تواجه معوقات حالت دون تحقيق نمواً كافياً يمكنها من توفير رعاية صحية لائقة أو إقرار برامج تأمين صحي جيدة لمواطنيها. كما تمثل الدخول المنخفضة للغالبية العظمى من سكانها عائقاً أمام الحصول على رعاية صحية ملائمة، وتشكل الزيادة السكانية المتنامية تحدياً هائلاً، فمن المتوقع أن يتضاعف عدد السكان بحلول عام 2050 بمعدلات زيادة هي الأعلى عالمياً، ولا يمكن بأي حال من الأحوال مجابهة هذه المعضلات الجسيمة سوى بتضافر الجهود وإقرار سياسات تدعم الشراكة بين المجتمع الدولي والحكومات والشركات لضمان استدامة الاستثمارات في مجال الرعاية الصحية بالقارة.
إن الشراكة مع إفريقيا فرصة حقيقية لتحقيق المصالح المشتركة واستثمار رابح اقتصاديا وتنمويا.
وتنفيذا لتوجيهات فخامة السيد الرئيس عبد الفتاح السيسي بدعم التعاون الإنمائي وتعزيز حركة التجارة والاستثمار بين مصر ومحيطها الإفريقي، تقوم الهيئة المصرية للشراء الموحد والإمداد والتموين الطبي وإدارة التكنولوجيا الطبية اليوم بافتتاح المعرض والمؤتمر الطبي الأفريقي الأكبر والأهم أفريكا هيلث إكسكون، والمقام تحت شعار بوابتك نحو الابتكار والتجارة، ليكون بمثابة المحور القاري للتجارة والاستثمار وأكبر منصة مستدامة في مجال الصحة بين الدول الإفريقية لتبادل الخبرات ومناقشة التحديات وإيجاد الحلول التي تضمن وصول الخدمات الطبية عالية الجودة والمتوافقة مع المعايير العالمية بجميع دول القارة. أفريكا هيلث إكسكون، معا نبني مستقبلا أفضل.
التنمية في إفريقيا لن تكون
Development in Africa wouldn't have been without having real partnership between all the countries, and because it was a must for all African continents to share experiences for achieving the common milestones. Now I will call Minister Ali Abdel Ghaffar, the Minister of the Higher Education and Acting Minister for Housing and Health, and then we'll have a word for the Mr. as known, the WHO Chief. In the name of Almighty God, Your Excellency President Abdel Fattah al-Sisi, distinguished attendees, I'd like to thank you, Your Excellency, for attending this African Health Hexagon. I also would like to pay tribute to the UPA and Dr. Bahadin Zidane, along with all of the teamwork that has been working for a year for having the well preparation for this great project under your own guidelines. Why Africa? Because Africa represents almost 16.7% of the world populations. So if the world population is 7.9 billion, so Africa is 16.7%. But we do have challenges that Africa counters, and for sure Egypt as part of Africa. So these challenges that affect the medical services on the whole continent levels, represented in the education level, increase of population and poverty, and the hesitant political situation. So for those who may think that medical services just rely on hospitals and medical calibers, it actually a whole system starts from education, roads, investment, and stability of economy and policy. So here we got in poverty, 67% of African people live beyond the poor threshold, and 64% having less than $1 annually. So we have around great value of African continents to suffer excessive poverty. In addition to the lack of educational platforms that we can get to more than 40% of literacy in all of the African continents, with around 60% of those escaping education. And Africa, just like other continents, suffers the increase of population, which is a great hinder towards or in front of any development. Poverty is threatening more than any disease or any virus. And maybe if we have diseases that lead to fatality, but poverty does have numerous negative impacts on our African continent. 50% of those who are born beyond 5 years in the world who die in the world, most of them they are in the African continent. So 50% of the world newborns who are dying, they are from Africa due to the respiratory diseases from AIDS, from diarrhea and other viral infections, and numerous diseases. Maybe the whole world focus on some diseases like like cancers and diabetic, and maybe beforehand we were just focusing on the viral infections, but now around 64% of those who lose their lives is due to the non-communicable diseases. So how can we expect to have such fragile hospitals to provide services to sick people, especially when we do not have medical services suppliers and which is part of the human rights. If we're talking about human rights to have medicine, so this is also one of the fundamental rights. So less than 2% of what African continent receive from medicines is by its own and autonomous medication, and we just get around more than 98% from abroad. This is the situation that we have, and we are part of our African continent. However, Egypt just has been able to predict, and within the past 7 years, to find non-traditional solutions to deal with these crises where we can have in common. So here comes the Egyptian strategy for developing the medical system. Until this moment, we still study the restructuring of the system from numerous aspects. Now we will talk about what Egypt has taken and how Egypt can play its role in supporting the African continent through numerous experiments that are successful, and we hope that the African continent also will benefit from. The access that I will talk about is the infrastructure, the medical calibers, and the medical services. When we talk about strategy related to medication, so we should have well-equipped hospitals. We should also have well-trained physicians, nurses, and assistants who are well-trained, along with medical services that can cope the infrastructure investments that took place. This is the system that any development may rely on. If we will talk about infrastructure, Egypt has invested in the past 7 years 300% of its expenditures. So we were 33 billion, we've reached to 108 billion. This is the level of investment in this sector. 196 billion Egyptian pounds has been invested in the past 7 years. Again, we state these figures to make sure that the country hasn't only invested in the agriculture, transport, and industrial sectors, but also great part of investment has been done in education and in health in the past 7 years. So the Egyptian state was working on all of the sectors with similar and equitable shares. So IMF has stated that Egypt is greatly investing. If we'll talk about medical sector infrastructure, so there is no governorate in Egypt hasn't witnessed upscaling or new constructions or development for infrastructure. So there is 55 billion Egyptian pounds in the past few years. And for sure what we have achieved through UPA, this is a real change in the organizational systems related to the medical systems that should be available for the success of the medical sector. We would take some examples, like Nasser institution that has been ratified to be a medical center where we can get 1,112 clinic and intensive cares and 100 intensive cares, along with 85 incubators, along with operational rooms, very advanced. So we have the transformation of 85 fittings from an institution that's providing annual services to be a global medical standard hub with all of its services and expertise, along with scientific research in all of the scientific and research domains. This institution, which is expected to start within the coming few months to be one of the fundamental arms in the Egyptian medical systems. So this is one of the examples. Also, the 500 National Cancer Institution along with another 14 affiliated centers throughout the different governorates. So we will find that this institution can also transform the cancer medications with the quantum leap, with more than 300 clinic and 800 intensive cares, along also with chemical and radioactive treatment through this place that can mitigate the burden of the National Cancer Institution that plays great role in collaboration with the affiliated centers. Also, one of the citadels of education and medication, which is Ain Shams University, and His Excellency ratification to change it to a medical city. So Ain Shams University provides more than 3,600 clinics and with tens and thousands of patients through months and days, with numerous specifications in all of the medical surgeons and consultants who work in collaboration with the medical calibers. If we will talk about Delta and Manufaya Governorate, also we see that the University of Governorate said there was a project to change and to alter the university to provide around 10 million patients with hundreds of clinical and intensive units along with operation rooms. So this is the investment that's taken place on the Egyptian land, and also for Galala, Jabal Galala in the Al-Galala city. And with the direction of His Excellency, the President, we wouldn't have been able to think that Al-Galala can have one of those global international universities in collaboration with all of the well-known world associations. And in the heart of this university, we have the educational hospital that's called Al-Galala Hospital. What you see now is actual pictures from reality. They are not virtual. So till this moment, we are contracting with the global entities to manage these hospitals, so we can have this hospital with 577 clinics with more than 50 intensive care units, and also intensive clinics for cancer treatment, along with 10 operation rooms and more than 87 clinics. What you see is just a part of the training and education unit. But again, this was not enough. But Egypt, and through the localizing of medications, to have self-sufficiency of medications through UPA, along with the national companies, on top of which Acdima company and Vexera and Holding vaccine company played their pivotal role in dealing and confronting coronavirus through providing and locally industrializing numerous vaccines. And also we got the national the local Egypto Farm venture with more than 500 billion Egyptian pounds to support the Egyptian economic, so we can reach to self-sufficiency, as to have 80% of our need to be locally manufactured. And we usually collaborate and cooperate with all of African countries, and I believe that this exhibition conference is a great opportunity to have numerous partnerships that Egypt can, through its promising industrialization, to reach self-sufficiency in collaboration with African continents. The other axis, which is the medical health and medical suppliers and medical calibers, we will have around 2011 hospitals. We have around 1,200,000 doctors, along with 125,000 of pharmacists and dentists, more than 15,000 of clinics. So that provide service to 60 million citizens, have played greatly that during encountering the COVID pandemic, we've been able to deal and to cope with these repercussions compared to other countries. And for sure, through the support of the country, to provide around 27 billion Egyptian pounds to boost repercussion, to deal with the repercussions of the COVID pandemic, either through upscaling the capacity and efficiency of the hospitals, or through manufacturing and industrializing vaccines. And we've seen this through the role model of encountering the COVID. Also, the medical education, which was a main cornerstone of this sector. We have around 43 faculty of medicine and 57 pharmacists. And in our medical system, we get around 30,000 graduates annually. still this is not sufficient because we have a great scarcity in providing medical service globally, but we spare no effort not only to help in graduating our physicians and specialists, but also to be well trained and well educated. And here we get the great support from His Excellency to support all of the related laboratories and the high educational specifications to have the AI laboratories and the virtual reality and augmented reality, all of the advanced medical systems that can help in educating and upscaling physicians have been provided. Even the virtual hospitals have been ratified, that we have 3 virtual hospitals to train and to educate all of the medical calibers. Moreover, and in collaboration with international institutions like Royal College of Surgeons in England, we have collaborated with also Harvard University and all of likewise world associations. So as you know, the medical system should be integrated where it has all of the facilities and the ongoing training calibers. The third axis, which is the medical services, what we were just talking about, it was the output, but not the outcome. So the output is everything that's been constructed or provided as activities, but if this wouldn't be changed into outcome, then we have a problem. So we have witnessed 2 issues. Let's start just briefly to let the Egyptian citizen understand and feels the kind and the quality of service on the long term. So we actually start to work on both levels under the guidelines of His Excellency in the past 7 years when we started to provide the rapid solutions by the presidential initiatives, and for the short and term through the Hayat Karima Decent Life project. So we got 11 presidential initiatives, maybe comparing to the world countries, they were having just 6 or 5, but Egypt has got 11 initiatives that are dealing with all of the age categories and all of the governments. So we have around 86 million Egyptian pounds have been benefiting with around 19.4 million Egyptian pounds. The level and the kind of service that has been provided, and since today we have Harvey Alter presence, which is Nobel Prize laureate, for virus C. So we are proud that we used to suffer from virus C, but with the political will to eliminate this virus, and now we have provided to WHO to announce that Egypt is free of virus C. So to detect around 2.2 million Egyptian pounds with the 3 billion Egyptian pounds and still ongoing. Also for the waiting list mechanism, and when we say that for around 36 Egyptian students, and to also deal with more than 1.4 million women for diagnosis and detection and early detection for breast cancer, and to try to change the family life with this great diagnosis and detections, we'll be able to early detect numerous diseases. And His Excellency has ordered and has given his orders that we wouldn't hinder and we wouldn't stop working. As for the waiting list, patients used to suffer for years from waiting until they get their operation ear surgeries for either cardio or even cancers. Now we have 1,300,000 surgeons have been conducted in the past few years with around 11.3 billion Egyptian pounds. So here we're talking about open cardio operations. We have also cancer treatments, operations. So what we see today and what we witness today is just one of the solutions that can mitigate the pains of the patients, and we are still working in that regard. His Excellency also has asked us to double-check the annual expenditure for such outcomes and how can we minimize the time frame. So now patient can just wait from 2 to 3 weeks to receive his medication and medical services. But again, we've got His Excellency guidelines to minimize this time frame to be just for 1 to 2 weeks. And the annual expenditure will be 1 to 3 billion to achieve such achievements. If we will talk about the revenues, each pound that we have invested or each dollar that we have invested, there is a 2.5% revenues, and also there is a great leverage from the assets as what's been procured by UPA have been now directly operating, because now we have list of daily surgeons. Also, we've got great opportunities for training physicians with around change from 5 to around 15 or 20 operations. So this has played a great role for mitigating pains and minimizing the rates of quality of life. So Egypt, and through WHO, has provided integrated file in the elimination of such viruses. But as for the short-term plan, was a decent life plan. And this is exactly what we try to operate, to provide more than 5 million Egyptian patients that was being provided in 6 governorates, and we provided 10 million service in numerous Egyptian governorates, and we are still working to increase the services. And as for the Decent Life Initiative, which is focused on numerous villages in 20 governorates, so actually Decent Life is not just concerning on sewage and related files, but actually also to provide around 24 hospitals and 1,000 ambulances to launch the first phase of the Haya Karima, or Decent Life. This is what we've been able to accomplish through the Egyptian state, and maybe this is integrated part of the system by which we can exchange experience to the African countries, but we are still ongoingly working and developing this relentless system, and to restructure and to remodeling the structure, and to work on increasing figures and participation of calibers to have a real integrated system. This is our experience that we can share with our African countries, and those who have wellness, they have everything.
Have the health has the hope, and he who has the hope has everything. أشكركم شكرا جزيلا.
Thank you for attentive listening.
Your Excellency President Al-Sisi, Excellencies, dear colleagues and friends, Assalamu alaikum wa rahmatullahi wa barakatuh. I thank Your Excellency for your strong commitment and leadership, which has galvanized a global movement towards the diagnosis, treatment, care,
أجل صحة أفضل من الكشف والرعاية الصحية وإزالة التهاب الكبدي الوبائي جيم. لقد أصاب هذا المرض أكثر من 1,100,000 شخص، ويعيش الملايين من الناس يعيشون بالتهاب الكبد الوبائي، وقد تم عمل الكثير في خفض معدلات التهاب الكبد الوبائي جيم وبه أيضا في أفريقيا، وهذا يعني أننا نحرز تقدم في خفض سرطانات الكبد وتليف الكبد، إلا أن العديد من البلدان والأقاليم لا زالوا ليس لديهم إمكانية الوصول إلى هذا العلاج. ولذلك توجد العديد من الاستراتيجيات ضد وباء الكبد الوبائي ج وب وأيضا وباء الإيدز، وتم خفض بمعدلات كثيرة. لدينا الأدوات لكي نصل إلى الأهداف المطلوبة، وهي هدف خفضها بدرجة 90%. المهم أن يصل الجميع إلى إمكانية العلاج، ونتطلع إلى هذا اليوم الذي تقوم فيه منظمة الصحة العالمية بالوصول إلى نفس الدرجات
and achieve the same levels of Egyptian experience in combating hepatitis virus. And with your collaboration, we can achieve this. And again, we salute you for your endeavors. Thank you. Your Excellency, President Abdel Fattah el-Sisi, ladies and gentlemen, distinguished attendees, now I will leave you with this dialogue where we have the discussion of the African experts to exchange opinions and experience. This session comes under the title of Towards Flexible and Sustainable African Medical Cities, where we get and dive in the medical and medicine files and the content and how to reach to integration file that we can achieve the interests of the African population. And we would like to notify you that this session will be divided into two parts. We will start with the first part. Now I will call Dr. Constantino Chwenga, the Zimbabwe and Minister for Health. Dr. Harvey J. Alter, who has awarded Nobel and the hepatitis virus experiment explorer. Dr. Muhammad Awad Tajuddin, the State Consultant for Wellness and Wellness. Dr. Aniva Bangrana, Minister for Ugandan Health. The session will be moderated by Dr. Khalid Abdel Ghaffar, the Minister of Education and the Acting Minister for Housing and Health. In the name of Almighty God, I'd like to ask you, Your Excellency, to have this dialogue session. And in the first part of the session, we are concerned with tackling the African medical systems and sustainability of these systems and how we reach to flexible systems. So in this session, we have Dr. Constantino Chwenga and the Zimbabwe Presidential Vice, and he's also the Minister of Health, and Professor Harvey Alter, the Nobel awarded in medicine in 2020, and Professor Muhammad Awad Tajuddin, advisor to the President for Health and Prevention Affairs, along with Dr. Anifa Bangona, Minister of Health for Uganda. This is the first part of our panel discussion.
And guests, ministers, it's indeed a great pleasure for me to have you here today. And we're talking about this panel discussion.
So we have this panel discussion which will focus on medical and sustainable health through upgrading the medical suppliers in Africa, along with the endeavors in that regard. So allow me to start by addressing my first question. So I'd like to address my first question to Dr. Constantino Chiwenga, and he's the Zimbabwe presidential vice. So from your point of view, what are the priorities of African medical sector, and how can we arrange those priorities in light of the political stance in the world, and particularly in Africa, which has its reflective impact on medical systems?
I will say it again in English.
And in your opinion also, what are the requirements in Africa from the world manufacturing companies? What are the priorities of the medical sector, and how can we arrange those priorities, taking into consideration the political stance in light of what we're witnessing worldwide? And what would you ask for the international organizations and world medical associations in that regards? Your Excellency, the President of the Arab Republic of Egypt, honorable guests, Your Excellencies, ladies and gentlemen, in Africa, we have learned a serious lesson. What's most importantly in what we need support. To build our health sector in Africa. And when I say that we have learned a serious lesson, so this was through this pandemic that we have all encountered. Especially just right after we get rid from AIDS, HIV, and right after we have been threatened by pandemic, but again to talk about the support that we need for the developing countries. So we found ourselves as part of this group, because most of our populations who have been trained by the usage of these limited resources that we have.
Conditions of service
and we were not able to provide high condition of service in terms of accommodation, in terms of transportation, and in terms of other facilities of the services that we are required to provide.
But to the developed world,
however, for the developed countries, these mechanisms and prerequisites were available. Hereinafter, we have been threatened by corona pandemic.
those we depended on,
and we've been impacted in our livelihood aspects where we found tough to provide especially through the crisis.
وذهبت الأموال وذهبت
And
الخدمات إلى
we
الدول
have got scarcity
المتقدمة.
of capitals and services,
وكل هذه
along
الخدمات
with the poor quality of service.
وهكذا فإن المساندة التي نحتاجها
Hence, the support that we need is to train our experts that we have lost them and they have just traveled to the developed countries. We also need to deal with the situation which is affecting our own people in terms of water and in terms of sanitation.
We want to learn,
So we want to learn, particularly since our existence and presence here in Egypt as Egypt has managed through these so little resources and with exploiting so little water to defeat these diseases that are accompanying water consumption, and especially with the water situation that has been raised, and Egypt has been capable to defeat all of the related issues. So I hope that we will learn a lot in this area, because this area is really in need, where we should learn, because most of us need to learn from Egypt. That's how through very little water, through this River Nile, which is still very little, but Egypt has been able to deal with this situation. We also would like to say that in order to deal with this situation, we need to have our own and our self-sufficiency in every field and in everything that we do, especially in medicine and medications. So if we were be able, and especially as we witnessed in the documented movie,
إذا تمكنا من صناعة أدويتنا وصناعة اللقاحات في أفريقيا، حينئذ سنقول أننا تمكنا من تحقيق إنجاز كبير. يمكننا
expectance in our life. We can see that through age categories, we need to improve the African life cycle. And in Zimbabwe, we would like to be part of joint ventures with Egypt in terms of the pharmaceutical field to address the challenges that we are subject to in Africa. Subsequently, we can be able to deal with the potential situations through our region, especially in the Southern African regional situation and the Southern African Committee, but we even can be part of the sharing experience to our brotherly countries. And through the various oceans and borders, we can be able to get back to support and to help those who are supporting us, those who we rely to have support from. So now we can change the situation and the client to be able to supply and to develop any vaccine and supply any vaccine or any required medications or any pharmaceuticals to any potential diseases. Thank you so much. And now, and actually we're so happy to have Professor Alti Harvard. He's American scientist and physician in virus, and he has been awarded Nobel Prize in the organs medicine in 2020. He has been reputed for his great endeavor that lasted for more than 4 years to explore the virus of hepatitis virus, and he's the head of the virus section in numerous centers like NIH in Maryland State. Dr. Harvey James Alter, who was born in 1935, who educated in Rochester, New York University. He has been awarded his medicine degree in the same university, and then he joined University Towson, and then he joined Washington DC, and then he joined NIH, and since '64 our honorable dentist, our honorable scientist, who has started to help humanity, where he's been able to explore this virus that was on Earth since 2,000 years ago and has caused the fatality of dozens of mankind and infected all people in the world. And we in Egypt were suffering this disease, as His Excellency the President has stated, and maybe through numerous years of numerous endeavors started since 1964, along with exploring the Australian antigen virus B. And in 1970, when he witnessed cases where we got no reason behind the kidney-related repercussions, and they were not related to neither virus A or virus B, and through providing blood transfer to some of the patients. So here started the question through numerous laboratories, where he started to work through since 1970 till he has explored in 1989 the new hepatitis, which has been known as hepatitis C or virus C. So we've learned from this great scientist through his experience and research as a role model for the world scientists. So please help me to salute our great scientist Harvey Alter. My question to Professor Harvey, part of it will be on how has he just summed up his life in just 3 minutes to tell us about his life experience, how he has been able to come to this exploration that has changed the repercussions of mankind. The second question, that he's been awarded Nobel Prize in virus C, and since Egypt has been suffering a lot from this disease, but through the intensive program to eliminate virus C in Egypt, through providing and through having a comprehensive diagnosis for millions of Egyptians, and to provide medication and related medicines to related diseases. How do you see this experience, and how to maximize this experience for the sake of the African countries? The floor is yours, Professor Alti Arden. Thank you so much. First of all, let me express how honored I am
وبالشرف الذي
to be part of this event and to meet His Excellency President Abdel Fattah el-Sisi for the first time in my life. And in regards to the Prize Nobel Award, maybe I can just sum up the 50 years of work in just 3 minutes. Let me just say that at the beginning there was no real vision on how can we accomplish this. So I used to work for the National Medical Center just as one of these youth physicians with my humble experience. I've been honored to collaborate with Professor Wimble, and we worked together on the antigenes. And we worked together in the file of Hepatitis virus. And after some of the practice and training sessions, I started to practice. So I got back to working in research and scientific research in the 70s. And I was concerned to see how can we get, what are the integrated related parts in the hepatitis virus. We found that 30% of those who provide the cardiosurgeons, they are infected by the silent hepatitis virus. And then we started to follow the situation. And even if they haven't got specific symptoms at the beginning, we used to still follow these cases. And we got through the notion of altering the individuals from donors to non-financial donors. And to take the patient cases and to study these cases very intensively, as to get to this kind of the unknown virus. And we found that the virus was just different from virus C and virus B. So we got another antigen virus that's impacting and causing most of the diseases that we have explored. So we've learned that we will get another surrounded fatty cell virus, and we get to virus RNA, which is associated, and that's been associated through Dr. Harun and his association to develop a kind of a test to test the hepatitis virus or H virus C. And found that it was not C and it was not B. So we found that there was a common result on testing both viruses. And this was maybe the end of the first part of having a solution for the virus. So we detected the virus and to eliminate HSC, which usually associated with the blood transforming operations, and we wouldn't imagine that we will have such good results, and just within 2 to 3 weeks we can just destroy the virus. This again was not out of science fiction, it was reality on the ground. So from the pharmaceutical industry we started to have the pharmaceutical institutions and associations have helped to provide great milestones. So till this moment now, if we will get any virus C patient, we can just easily cure them. So again,
when you have great tests, we don't need better tests. They're not very much better. We don't need very much better drugs. We have them. What we need is the ability to find people who have silent HCV infection and to get the drugs to them. And no one has achieved that the way Egypt has achieved that. Tested over 40 million people, maybe it's 50 million people by now, found out who was positive for antibody, took those people, tested them for virus, the virus itself, an enormous effort to do that, and then treated everybody with drugs that were prepared here in Egypt. So the whole spectrum of, it starts from the top. You need the president, you need the minister of health. Egypt has done that, so it's become the model. And I think we're here to see, because we now have the proof of how this can happen. And the ideal now is to do this in every country in Africa and throughout the world. And I tell you how hard it is in a country with lots of money. In America, we have not done this. We have been unable. We're just starting to treat our own population. So Egypt must be very proud. It's really an enormous accomplishment. And now Egypt is offering help to other countries, offering tests, offering vaccine. But what needs to be done is to get the president of each country and the ministers of health of each country and the ministers of education to start the process country by country by country. It can be done. I can feel the hope in the room. The possibilities are here. And it's up to you. It's up to you to go back to your own countries to get this to happen. If it does, it'll be a miracle. But it can be done. So thank you very, very much. It's a real privilege to be here.
Well, I think I have to ask you one more question. يعني الحقيقة هو يمكن شرح الموضوع ببساطة شديدة جدا.
You have just very simply illustrated the situation. But again, he stated that he has been encountered with lots of challenges and lots of frustration situations.
And you also mentioned that there is no elevators to success, and you have to take the stairs. Can you talk about to us about these two stations in your life? هو كان بيقول ان ما فيش حد بيطلع النجاح بمصعد كهربائي، ولكن النجاح لابد ان يتم من خلال صعود سلالم طويله. 50 سنه من العمل في البحث، مش كل المرات كان بيطلع بنفس النتائج. ممكن يقعد يشتغل 3 سنين او 4 سنين ثم يفوجئ ان كل اللي بنى عليه افكاره طلع غلط.
For 3 years and then he comes to a situation where he just found that everything he was working on was fault and just to repeat the cycle from scratch. So I was asking him about the poems he was writing about depression.
Well, I'm going to talk this afternoon and show slides of what I've tried to summarize in a short time, the whole story from the beginning and the end of hepatitis C. But along the way, I've written different poems to talk about different aspects of this discovery as we went along. So this afternoon, I will give 2 poems. One is, I think that I shall never see this virus called non-A, non-B. And the other one is an ode to hepatitis C, which I will say at the end. But I found that poetry has been a good way to get people to laugh and but to get the point as well. So that's been my modus operandi. Thank you.
Thank you very much. Now we move to Her Excellency Hanifa Bangwira, the Minister of Health, Republic of Uganda. صاحبة السعادة السيدة حنيفة كوية بن وزيرة الدولة للصحة بأوغندا. وسؤالي لمعالي الوزيرة وهي سياسية أوغندية عملت كممثلة للمرأة في كثير من الأوقات من خلال عضويتها بالبرلمان الأوغندي، وأيضا عملت في كمندوبة في الجمعية التأسيسية وشغلت مناصب عديدة في التنفيذية في المجلس الوطني للمرأة. سؤالي لمعالي الوزيرة وهو خلال فترة التعافي من جائحة كورونا يقف قادة الصحة في العالم بين مطرقة التهديدات الصحية وسندان الاحتياجات الصحية والتي تتطلب تخطيطا واستعدادا مستقبليا أكثر توازنا من منطق منصب سيادتك كوزيرة
So from your own point of view as a Minister of Health, from political view, what would we need to maintain and to ensure sustainability of the medical systems, and what is required to convince political leaders in African continent to put on top of their priorities and agendas, especially within the darkest time? The floor is yours.
Thank you so much, Your Excellency, the President of the Republic of Egypt, distinguished Excellencies, distinguished participants, ladies and gentlemen, protocol observed. To put the record right, I'm not a doctor. I am the Minister of State General Duties in the government of the Republic of Uganda, but I have a long, wide experience as a politician, 30 years in the legislative body of Uganda as a member of parliament, 5 years as a member of the Pan-African Parliament, and I'm a gender activist. And in the health sector, I am one of the passionate members in my country. Your Excellencies, I'm happy to be here and to be part of this historical event. As the question is put, that how, as a minister, do I do to see sustainability of the health services the post-COVID-19? Your Excellencies, COVID-19 pandemic has significantly impacted and weakened all country systems all over the world, the livelihoods, and more so the developing countries. The pandemic has caused social and economic crises characterized by immense unemployment, increased employment, and the excavation of longest-ending inequities. On the other side, COVID-19 brought us together as one people. It was a unifying factor. And the reason I think we are here, unified for a purpose and a cause, to ensure improved sustainability in the health service care services. Your Excellencies, now that COVID has diminished, countries need to take advantage of the phase to regain strength and lobby for resources to build resilient health system, health care. However, as we do that, we should not forget that our country's economies also were affected and slowed down. We need to have now the experience of surveillance and predicting the trends of the machine must not only go to sleep, but we must all work together. We must walk the talk together, all of us. There is no member state that can walk the talk alone as an individual if we have sustained our goals to ensure that there is health care systems that have got infrastructures that can be sustainable. Believe me, you or not, official path recovery is a very delicate one. We need to balance our efforts of resources. Much of our resources in our member states, much of our budgets goes towards defense. Yes, we all want security for our people, security for our property, but we all know that health is life, health is wealth. You can't secure a sick population. Therefore, we need to put much resources towards the health sector. Once again, however, this stage of the pandemic, countries also need to invest in more of the availability of essential healthcare services. We must walk that talk, and one must keep build back better approach. We need to achieve the immunization, coverage, better antenatal coverage, better postnatal coverage, better ARTs, among others. But we again wish to push our governments. We should not forget that the government should also look to how to accelerate our post-economic growth after the COVID era. It is now at this early age that early recovery and transition of long-term recovery to ensure that sustainability in the health sector services is a must-have. All of us must ensure that we are together into this. COVID-19 has definitely shown the world that investments in health system translates into economic progress. This is the only way we can go. We need to invest in global health security, disease surveillance, and preparedness, as my other participants have said. We need to rethink how health promotion and health education and provide social vaccination where the population accepts the trust and the official proven information. Therefore, accurate collection of data and sharing is a must-have in the continent. We must use community resources, persons, to provide best health promotion and referrals. We must have a referral health system that transits back into our populations. We must ensure human resource for health is adequately funded. As I've already said, we should look for efficiency and savings in the health sector. Finally, we need to prioritize vaccine access by all citizens. We saw it during this pandemic. We were not prepared. We didn't have vaccine at hand. It's a must prioritize vaccines access by all and together. Massive campaign for vaccination against COVID and other immunizable diseases, improve nutrition of citizens to build our own immunity. We must have healthy communities. We must encourage research and innovation as Africans to produce vaccines for our people instead of waiting to get vaccines from the developed countries. We saw how it hampered to all of us. It's the time that we must put all our efforts together as a continent to ensure that we invest so much in vaccination productions. Funding of all budgets must be improved continentally. Lastly, it is my humble request that if we have to have sustainable health system, a sustainable health community, sustainable West Africans, a population that is not under-impoverished, we must walk that talk together. We must all invest in the health service sector. I thank you.
Thank you, Your Excellency. والآن مع أستاذنا الأستاذ الدكتور محمد عوض تاج الدين
the Presidential Advice for Protection and Health. For sure, he's a great scientist in the respiratory diseases, and he's on top of the scientists and professors of Ain Shams University. He has joined numerous positions as the president of Ain Shams University, and now he's the Presidential Advisor for the Health and Protection. Now I call His Excellency to participate with us in this interactive panel discussion about the African diseases and how to deal with, and how Egypt can support the brotherly African countries. The floor is yours. Thank you so much, Your Excellency. Your Excellency, President Fattah al-Sisi, we wouldn't have got such conference without presenting my sincere gratitude. And due to what Egypt has witnessed recently in the healthcare sector, and what we have achieved has never been witnessed prior to this, and we've been witnessing for quite a long time, witnessing the spectacular, endless problems of health sector. and for sure it would still last because we have a great excess increase for population, so this is potentially expected. But what we have achieved, and this is not a personal point of view as an Egyptian citizen, but this is by the world acknowledgement that what we have dealt with through Corona and with the repercussions of the Ukrainian Russian war prove the relentless will and the relentless political will that hasn't ever been in supporting medical sector. Medical sector is not about just hospitals and medications. The weight and the reclamation of weight and the silos, the electricity, transportation, all of these just directly affect health sector. In the past 3 days, I was trying to study the common treasure. I found that there have been some great figures due to your great guidelines. What we have witnessed in Corona and the great achievement that's been provided by all of the Egyptian-related entities with the great armed forces in collaboration with the police, governments, His Excellency Prime Minister, who has spared no efforts to support the medical sector. We have to acknowledge that this was a great success. Now, getting back to the question of His Excellency the Minister of Housing and Health, Africa is suffering greatly. Africa is combining numerous diseases. Yes, we can cure and we can even eliminate. And I can give 2 examples for a couple of those diseases. So till this moment, we still have the TB, still around 500 African citizens lose their lives due to the TB. And there is around also 95% of malaria patients are in Africa, and 96% of those who lose their lives due to malaria also are in Africa, but still it's curable. And maybe in one of the Geneva WHO sessions, there was a session for one of the well-known experts. He was talking about the HIV, which is also in Africa. So I stated, and I said, right, what about malaria? What about tuberculosis, which is still causing disease for Africans? And maybe we can get the vaccines for malaria. Maybe the average of children who lose their lives in the first year or even in the 5th year of their life cycle is the highest in Africa. Also for the pregnant who lose their lives in Africa is the highest. Even for the monkeypox virus is also emerging from Africa and then started to prevail everywhere. Your Excellency, we've tried our hardest to work through our executive roles through universities or medical sectors. We try to have Africa, and maybe there is Anas Al Wugood vessel in Nasser Lake that has the protection for northern Sudan and Egypt, and we can state that we have no malaria infected cases in Egypt. And also as for the new cases for tuberculosis, for the past 7 years. We have great improvement in the tuberculosis, and the average age category for Egyptians, and in Africa, as you know, the average age is around 60-something or 50-something, and even in other countries, 30-something. In some countries, the average of children, the fertility is the greatest. For sure, also diarrhea and typhoid diseases, they are all prevalent in Africa. But Your Excellency has guided us with lots of things that we now can feel or can reap its fruits. And as you know, the pharmaceutical city is now producing. Your Excellency has asked us to localize the new drugs, and we started on this. So now we have productivity for lots of products, along with the Japanese and sales companies for the localizing of cancer and tumor drugs. Also have great human capitals. So when we just announced about this conference, there is no Egyptian physician or Egyptian professor who asked to join and to participate. We have tens of hundreds of human capital. We have great medical indicators that are performing positively in all sectors. But again, for the African human age, average age is improving. So this year we have around 72 to 0.38%, and we hope that also males and females will get the required medical services, and we have annual improvement. And again, talking about Africa, Africa is suffering and will continue suffering. And we have all seen the chairperson of African Union when he was talking about we may find excessive African poverty and African famine. So we have all to take the steps. We all have to make use of the great capacities that we have. But again, I need to say that Africa requires to have a relentless African decision, and I believe that Your Excellency can lead this list of decisions to secure Africa, which is in need for being secured. Thank you so much. I also would like to say that we have great ties with Africa, resembled in the River Nile, the great River Nile that links us with Africa. Thank you so much. Now, and since we've come to the end of the first part of the panel discussion entitled the sustainability for medical systems, I would ask you kindly to have a short break and then to get back to the second part of the panel discussion about the role of the international companies and local companies along with the world companies for contributing in the pharmaceutical sector. Thank you.
وهكذا سيداتي وسادتي تكون قد انقضت الجلسة
السيد الرئيس عبد الفتاح السيسي رئيس جمهورية مصر العربية.
President of the Arab Republic of Egypt, ladies and gentlemen, distinguished attendees, we welcome you to the African Health Hexagon conferences. Now we will resume back the panel discussion about flexible and sustainable medical systems. In the second part of this panel discussion, we will have Dr. Mohammed Assam, head of UPA, Dr. Ahmed Oma, the acting African Agency for Protection and Diseases in Nutrition, Dr. Angia Batista, the assistant for WHO for pharmaceutical and drugs, Dr. Aravi Bashkar, the general manager for pharmaceutical. This session will be moderated by Dr. Khaled Abdel Ghaffar, Minister of Higher Education and acting Minister for Housing and Health. I will ask Your Excellency to commence the session. The first question to Dr. Maria Simao, and she is the WHO Associate for Delivery of Pharmaceuticals. What is the WHO perception for equitable distribution of vaccines, and what are the current opportunities that should be exploited to avoid any future decrease in the supply chain? The floor is yours.
Thank you very much.
شكرا جزيلا. أود أولا أن أعبر عن سعادتي.
Thank you for inviting WHO to speak at this opening session. Professor Ghaffar, let me say this is a very good question. Because what this pandemic has shown us is that the importance of diversifying manufacturing capacity. Right? Some new technologies, key technologies like mRNA technologies, for example, in some of the biotherapeutics, they remain concentrated in very few manufacturers, and access that the developing world had to these technologies was very, very scarce in the first year of the pandemic. So one thing that WHO wants to say in this forum is that we think the Arab Republic of Egypt is very well placed to move this agenda forward, and it's clear that also bringing together so many stakeholders as you're doing during this event will enable two things: with a regional production models that builds on existing capacity and that enhances collaboration between the different countries. I think the previous panelists showed how the different capacities and what can happen in the continent. We know, for example, the mRNA technology can be a quick fix in the pandemic, although we do have only two that worked for vaccines, right, for future outbreaks. But it also, like Professor Tak Eldin mentioned, it can help us to develop vaccines against malaria, HIV, and TB, which are diseases that plague the developing world. So it's still very concentrated, and we need to learn how to do these things. So let me just talk about, you asked about the opportunities, WHO's vision, and we say some are challenges, people say problems, but let's take this as opportunities. First one, that's access to know-how for new technologies. WHO is addressing through the technology transfer with mRNA training hub, and Egypt with 5 other African countries are spokes of this technology. And that's where access to know-how is where the public-private partnerships can help, right? Because we had delays in tech transfer because the IP holders did not want to share technology. Right? We know that, some of them. The workforce capacity, and then that's another opportunity because WHO is addressing this through a biomanufacturing training hub in the Republic of Korea, and this addresses needs from the private sector and the public sector as well. Know how to do the components and everything. And let me say an important issue is the regulatory capacity, because without strong regulatory oversight, there's no quality assurance at country level, and there's no entry into the international market. Right, so let me congratulate the Egyptian Drug Authority on achieving maturity level 3 for vaccines using WHO's global benchmarking tool. This is a major achievement and reflects the strong, very strong commitment from the government in making this happen. Let me say that in the African continent, we have 45 countries who start to do the benchmarking. 4 of them have already achieved the maturity level 3, which is functional, and we have 4 that are very close to get there. So this is extremely important because the two things have to go together: local production and regulatory oversight. And the 4th area, which I think it's a challenge, well, the others are more of opportunity, but it's the commercial sustainability. Right? And building facilities is the easiest part. Doesn't sound so easy when you're doing it, but it's the easiest part. But building sustainable facilities is the big challenge, right? And that's where all regions and countries and all regions need to work collaborative together to develop a coherent plan for production that includes who is going to buy in the future, right? The market. So WHO is very grateful for Egypt's high-level leadership. I think this is undoubtful. And we look forward to a continued collaboration initiatives that will increase supply security and at the same time that increase access to the medicines we all need. Thank you very much.
أشكرك. دكتور أحمد أجويل أوما وهو نائب مدير المركز الإقليمي لمكافحة الأمراض
Regional Center CDC
سؤالي الموجه إلى سيادته هو من وجهة نظرك ما هي الفرص التي يجب أن تستفيد منها الدول
الأعضاء what are the opportunities that member states should leverage in the coming period through this organization to promote medical systems, and what's the role that will be played after COVID arena to continue supporting medical systems? The floor is yours.
Thank you, Honorable Minister, and Your Excellency, President of the Arab Republic of Egypt, Excellency, Deputy President of Zimbabwe, Excellency, Deputy Chairperson of the Africa Union Commission, Excellencies gathered here, ladies and gentlemen. Let me start by sharing 2 lessons that we've learned during this pandemic as a continent. First is, when there's a really big problem across the world, Africa is on its own. And I'll repeat that, Africa is on its own. The second lesson we learned during this pandemic is that when Africa comes together, very good things happen. At the beginning of this pandemic in 2020, our heads of state, and we thank President El-Sisi, who was part of the Bureau, met regularly to provide guidance to us as Africa CDC and the Africa Union on where we should be heading in as far as addressing the pandemic is concerned. So if our heads of states are coming together, our ministers are coming together, our technical teams are coming together, it is time that the private sector on this continent and all those from outside of the continent and working and doing business on the continent, they need to come together with us to address our challenges. These are 2 key lessons that we've learned. But out of every crisis, there is always opportunity. And for our member states, the 55 countries on the continent of Africa, I suggest to you that the opportunities lie in 4 areas. First is we must strengthen our continental institutions. Strengthen Africa CDC, strengthen the Africa Medicines Agency, strengthen all those institutions that address issues of public health, including non-health institutions. At country level, we need to do the same. And we are looking forward, Honorable Minister, to coming to celebrate Egypt CDC sometime in the near future. Second is we must build the capacity of our workforce, and not only health workforce, it is all professionals who contribute to addressing public health problems here on the continent. We need to train them well, we need to have them in the correct numbers, and we need to deploy them in the right places so that we have a very good idea when a small problem starts, we address it before it becomes big. Third is we must build our own capacity to manufacture every health product that we need on the continent. It was very embarrassing at the beginning of this pandemic that we could not be able to make available to our citizens very simple things like masks and even more complex things like vaccines when the time for vaccination came. So we must build strong capacity on the continent to manufacture everything that we need. And finally, we can't do this alone, so we need to partner. But the partnerships need to start at home, where government and private sector, members of the public and the professionals work together to ensure that no future outbreak, epidemic or pandemic catches us unaware anymore. And then we can invite partners and friends from outside of Africa to work with us. And Harvey, I want to commit to you that the commitment we have received from the government of Egypt through His Excellency the President of supporting hepatitis control activities across the continent, we are going to do it within your lifetime. Africa CDC is committed to ensure that we adapt the experience of Egypt to other African countries, and we are looking forward to a time when any epidemic that comes, we are ready for it before it becomes a pandemic. Thank you, Excellency.
دكتور تامر عصام رئيس هيئة الدواء المصرية أصبح دور الهيئات الرقابية المحلية والدولية واضح جدا.
The local competent authorities has become so spectacular, especially with the evolvement of vaccines and drugs manufacturing and the future progress that we can anticipate in this important and significant sector. How do you think that the authority can play one of those incentive roles in productivity of medicines, and how can we keep the balance between surveillance and support? The floor is yours. In the name of Almighty Lord, Your Excellency, and I would like to thank you for this great gathering of our African brothers, and as His Excellency has taught us to talk with figures. So I'd like to share some of the slides that can showcase how Egypt has been able, with the headlines, for having a crystal clear vision, to have a real competent capacity. So when we talk about Egypt 2030 vision, this was a result of relentless will and the crystal vision that we own real capacities. And this was through some of the steps, most of which was the investment. So through this structural work is to have the world acknowledgement by WHO that has been done in the past September, which is the third level, which is a great merit that we are crowned with as the Egyptian Medicine Authority, and has put Egypt's name on a different level in the world. And I can state that through all of the international conferences, we usually have such honor. But again, this is what we have been capable to achieve in our new Republic of Egypt. The second point is all of the world medicine calibers have been proven that for Egyptian medical sectors through the figures that in 2015-2016 the average of Egyptian market was 62 million Egyptian pounds, and now it's 149 million Egyptian pounds. In 2015 we were ranked in 37, and in 2020 we have become as the 29th, and we anticipate in 2025 to become the 24th. However, along with our partners and our local manufacturers, we will become on top of the 20 world in the world. So when we look at our classification for the world ranks, so we are one of the countries that's being classified as one of the manufacturing localizing steps compared to India and China. Moreover, our positive results are even growing compared to other countries. Let me give you some figures to prove some models of how the Egyptian Egyptian state has been deeply supporting investments, because otherwise we would have got great repercussions. So the first example is the one that we feel proud of, which is the success of the presidential initiative to cure more than 2.2 million patients by 100 million wellness initiative. And again, this was through the guidance of His Excellency to localize HIV medications, and this was through more than 10 Egyptian companies that has directly got to the impact that the cost for treatment has reached to $50, while at that time it was $10,000 in other countries. This has enabled Egypt to have or to set these lines of gold in our history of gold achievements. Also through the COVID era, Egypt has proven its great capacity through providing all of the new COVID vaccinations, and again that was through the localization of more than medical companies. And again, by figures, we can state that during Corona, Egypt has consumed 233 million drugs that have been locally manufactured. The cost for this was 6.7 billion Egyptian pounds. If we have not relentlessly invested, the cost for such pharmaceutical that's being consumed would have reached more than $2 billion. So we've been able to provide these exporting bill by operational activities of our factories. Moreover, because we do have a relentless well and crystal clear capacities, we've been able to export more than 44 million packs to 77 countries with around 114 million USD. So again, this proves Egyptian vision and its keenness to greatly invest with the capacities that we have. Also for the antibiotics and the modern antibiotics. So since 2015, we used to consume 2 million pack, which around 22 million USD for exporting. And as we know, because of the Egyptian planning, this is the future. So there was a clear guidance to start localizing this, and now we have 3 production lines that have self-sufficiency that has 97% of self-sufficiency. And then when we got to the waiting list, we found that there was a higher demand, maybe triple the amount of demand for these packages. So we would have got to around $90 million for our exporting bill. However, with our political will, we've managed to have localizing for saving more than $70 million annually. Another example that Egypt is aware of each and every single detail. So in 2015, our exporting for the site drops with around $3 million. And this is not that big, but again, His Excellency the President has guided us to even not to avoid this light and slight percentage, and we started to localize it to have the 4 production lines with around 95% of self-sufficiency. When we started to increase the consumption in 2020, 2022, so we found that we were able to provide more and to cover $2.5 million annually. The second part is the partnership, which was our title for planning and having competency, along with the collaboration with the private sector. And we found that in 2016 we were having just 130 factories, but now we have 170 factories, production lines. In 2015, 2016 was only 500. Now we have 700 production lines with an increase of 200 production lines. And it's worth to see that the 200 additional production lines, they are highly qualified and highly technological lines. Also, it was very important to showcase securing the national security, but also to attract the FDI and also the local investors investors, because business speaking, there should be capital investment. So whenever there is a potential investor who would expend more on capital investment, and the revenue rate takes a long time, but with the existence of infrastructure and the existence of the great pharmaceutical city has facilitated this and has facilitated the investment revenues, and this has attracted global companies that started to invest, and we already have got two of partnership protocols with two world leading companies. Your Excellency, we thank you for your great guidelines, and as you usually teach us that all of the achievements of our Egyptian state is ready to share and to share experience with our African countries, and we will continue working and to keep praying to our Almighty God to usually fit to our positions. Thank you so much for attentive listening. And last but not least, Dr. Rafi Baskar, my question to you, you're the representative of Pharmaxil, and now how can we get the partnership between governments and pharmaceutical companies to have security, especially that we should have ongoing relations? The floor is yours.
Thank you very much. His Excellency, Mr. President, and the distinguished people and ladies and gentlemen. Really, it's my privilege and great honor to be part of these discussions, and I'm very much thankful to UPA on behalf of Pharmaceuticals Export Promotion Council of India for giving us an opportunity to participate in this. So my question seems to be, the objective always of the countries as well as the companies to provide an access to the medicines and affordable medicines. These are the objectives what we are discussing throughout the world, and unless otherwise, if you provide affordable medicines, it's very difficult for the developing country to have a meaningful healthcare system. The government and industry work together, and government has to provide conducive environment to take the pharmaceutical industry to go forward. The pharmaceuticals, the vaccines plays a very important role in the healthcare system. Take an example of India. India was import dependent in the 80s. Now we are exporting to more than 180 countries. The Indian pharmaceutical industry values almost $50 billion US. Out of that, 50% we are exporting. Then we have highest number of US FDA approved facilities outside USA. This was happened just overnight, not happened just overnight. So we need to have a sustainable efforts and policy and political commitment from the government to address this issue. Now, take for example, the collaboration between the governments and the companies, how it give a positive outcome. During the pandemic, the government of India has supported Indian vaccine industry to develop a vaccine in collaboration with the national research institutions like Indian Council of Medical Research and National Institute of Virology. So there is a serious need to have a collaboration between academia and industry. This is not happening particularly in the developing countries, including India. So this is the area where our African brothers and the Asians and the countries like India also to move forward. So we have seen an unprecedented situation during the pandemic. Nobody knows. Our friends were talking about we are not having a mask. The situation was the same in case of India also. So now we reached to a level of developing an indigenous vaccine within the shortest possible time. The same kind of an approach was also taken by the government of United States of America. They funded the vaccine manufacturing facilities. So this is to be continued, and the research and innovation should take any country forward, and we have to focus more on that. And the government of India has also announced product-linked incentive scheme. So unless otherwise, every country have their own capabilities to some extent, it's going to be chaos during the pandemics. So with this, the time given by my friend is very, very, very short. I would like to confine and stop here. And once again, I'm very much thankful to His Excellency and President and UPA, once again giving us an opportunity. Pharmaceuticals Export Promotion Council of India closely worked with UPA and Egypt and our African friends, and we'll take it forward, the agenda, and with what objective this conference is being called for. Thank you very much. Namaskar.
And now we've come towards the end of this panel discussion. Now I will summon His Excellency the President for any remarks. The floor is yours. In the name of Allah, the most merciful, the most compassionate, let me firstly start by welcoming all of the participants and to pay tribute to the great efforts that's been exerted to have such conference in place. And I look forward that my greetings to Dr. Harvey will be addressed to him. I was talking to him while we were just together in the breakout salon. But now also I'd like to state it to the whole world, whether those who are inside the halls or even those that's viewing us through screens, I pay tribute, gratitude and respect, and I personally thank you. And I want to say that it was a great honor to meet you. It was me who's honorable to meet you. And let me say it again, that in Egypt, and personally speaking, we were thinking that this disease is greatly painful, and it took us ages to suffer from. And as you stated, that if we have hope and will, we will have real achievements and breakthrough. With hope and will, we can have breakthroughs. So when I used to say that there is no place for someone who can find real curement for this virus disease, so I can say again from personal point of view that this was one of the things that I kept thinking about for ages. So thanks Almighty God that I've witnessed that this disease is being cured, and not only this, but also to contribute along with my Egyptian people to eliminate this disease from the Egyptians. So I would like to state that our great scientists that maybe people do not know about or maybe do not see them, but they can see their results. It is greatly appreciated for all mankind that when we conducting the comprehensive diagnosis, we were having around 90 or 95 million. Today we are around 104 million Egyptians. But I wanted to say that when we started this diagnosis on the ground and we launched it nationally, and then thank God we've been able to be successful. And I just want to deliver a message to our African brothers and sisters that do not think that scarcity of resources may be boundary achieving your objectives. For sure, any objective requires having lots of things. However, from our own experience, and I can remember that when I called for the American pharmaceutical companies and we were talking with them about contributing in providing the affordable medications that we can provide for millions of Egyptian patients, and we found that despite the fact that drugs at the time used to be for like 10,000 USDs, however, we have got it for less amount and less price, and this is why I would like to thank the pharmaceutical companies, and I want again to state that Africa is a promising market. If we are 1,250,000 or 1,300,000, so within 20 or 30 years we may reach to 2.5 billion people. So it's a very promising market. Subsequently, the future is for Africa. The future is for Africa. Maybe you cannot believe me, but the future is for Africa. I want to say that 60 or 65% of African population is youth. So we still have a greater opportunity. So I just want to reiterate that I want to record on the behalf of Egyptians our great gratitude to Professor Harvey, or even to the pharmaceutical companies, all of our gratitude and appreciation. And again here to just comment on our panelists, whether who participated in the first or in the second session. I wouldn't talk so much, but I just want to say that since we are an African country, just like other African countries, we do not have great capacities or great resources, and our population is not less. We have more than 100 million Egyptian pounds. Comparing to other African countries, even do not have such amount of populations. But by stating this, I want to state this firmly and relentlessly, that we are ready to collaborate in all of the fields that you pursue to collaborate. I wouldn't mention the fields, whether medical, educational, or even rehabilitation sectors, but I want to say that the Egyptian capacities are available for our brothers. And this is not political speaking, and maybe my colleagues in the government do understand to which extent do we support and do we appreciate to anyone who may suffer, not just in Africa, but even in the other continents. In Africa and all of the other countries. So again, I'm not saying that we are owning excessive resources, but what we have is available to serve, to participate, to train, to educate, to cure, to exchange experience, or to share experience. We are ready to do this, and even beyond, in all of the sectors, even in pharmaceuticals, industrializations, and as we and our colleagues talked about the vaccination industrialization. And here, let me just state humbly, announcing 30 million vaccines, COVID vaccines initiative to our African countries. And I hope that this to be done in line and with the synergy of African continent and of African Union. And as His Excellency stated, that if we have a world crisis, Africa is still left behind. If we have a world crisis, still Africa is left behind on its own. Africa does have tremendous resources in everything, starting from human capital into the other resources and capacities. So let me share one of our own experience. When we were talking about our economic capacities that did not match to provide international standard services to 100 million Egyptians, and we acknowledge this. So we had to seek through thoughts, through ideas, through the guidance of Almighty Lord to find solutions. So if we have the capacity to provide medical services and to find solutions, literally solutions, we wouldn't have a problem. So we usually face issues when we have scarcity of resources and scarcity of allocated budgets. So in Egypt, we haven't said that it is impossible. We haven't felt deteriorated or depressed. I again share this with you because maybe Egyptians have heard this quite a lot from me. But again, there has no single boundary that can hinder our relentless will to overcome this boundary. So do not ever think, and again, I state this in the presence of the scientists and the well-known pharmaceutical companies who haven't achieved their success through hopes, but through endeavors and well. So again, let me say that we've solved lots of things through initiatives like the 100 million wellness initiative, like Virus C initiative. All of those were targeting specific challenges. When we overcome, we will be on a totally different sphere. So let me say that also the waiting lists that we were talking about a while ago, we were not talking about just a normal medication. We were talking about massive medications. We were talking about massive surgeons in all parts and organs of the body. So when this was proposed, we said that we will target waiting lists and we will have no waiting list in Egypt. At that time, the number that was tendered was not that big. But now, and after around 4 to 3 years, the number that we've managed to achieve, I think that maybe compared to other developed countries and more economic, powerful countries have not been able to provide this. We have 1.3 million operations, big operations. Each one may have around 300 Egyptian pounds, even more. We're including lots of things like moving organs, and for the cochlear implants and for the prosthetics. So when they were saying that there will be around 3 weeks waiting time, so I asked to minimize even this time frame, that we cannot bear to have patients who feel pain, and we try our hardest to minimize this time frame and to operate and to have these surgeons done as soon as possible. And when we achieve to target these waiting list numbers, and again, I just want to deliver a message to our colleagues here. Maybe you can provide comprehensive medical or health care. Again, we were targeting to have the comprehensive medical care to end within 10 years. We work for achieving this, and when I got the first proposal, they were just talking about even around 15 or 20 years. But I said that we wouldn't be able to delay providing such a highly important quality of service to our citizens after 20 years. For sure, there should be compatible infrastructure in place. However, we worked, we launched our program, and we started to take our activities. Now we have it applicable in 5 different governorates, and we can say that within the time frame that we are committed with to implement this plan, just within 10 years, we will accomplish to provide comprehensive medical health care to all Egyptians. And I wouldn't forget to mention that yes, we do face lots of challenges, but it hasn't hindered us. Let me give you an example. we have around 2.5 million increased populations on annual basis. So maybe you have around 500 fatalities, so we have around 200 million citizens increased every year. So if we will provide around 2,000 clinics to our patients, so this would need around 4,000 clinics. That will cost around $2.5 million. So I just need to add around 4,000 clinics with around $2.4 million just for wellness. Has that set us aside? Have we felt handicapped? Have we said that we've scarcity of resources? No, but we kept working. We kept challenging our fears till we overcome the challenges. Yes, that was the situation. So through the presidential initiatives that we have launched in terms of targeting specific diseases, to make sure that even if we cannot do everything, we at least can provide part of what we want to achieve. So I here want to deliver a message that in each sector we have got a unique experience. Maybe I've heard the remarks of Zimbabwe Deputy President when he was talking about water, and maybe because it's a great opportunity now to speak about this, and for my African brothers know that we have 55 million meters for the water share, and this is not being changed through years. But still, have we got into conflict to increase our share of water? No. However, we've been working to maximize the resources and not to lose single drop of water, and I'm not exaggerating when I state this. And again, I'm not saying this for political purposes. I'm just stating this because any challenge is an actual opportunity. Do not consider challenges as boundaries, but rather opportunities to overcome. And we've been able to provide programs for 3D water desalination programs. Let me say that the programs that we have provided in that sector to make sure that Egyptians throughout Egypt to have water compatible to the international standards of WHO and to leverage the water drops to greatest levels. So maybe it would come as the first or the second world countries to maximize and to leverage the treatment and the water desalination for its people. So again, the challenge, because maybe everyone just would say that Africa is capable. Africa is capable, and if there is a challenge, still together, hand in hand, shoulder to shoulder, to overcome. But maybe there is one last thing remaining. What is the challenge that can hinder the countries? I would say that maybe the developed countries wouldn't be concerned with this. But again, I'm stating this to be recorded. When I was saying that security and settlement is one of the human rights, maybe lots of people wouldn't understand it. So I said that when you talk about, especially in African countries, and particularly in Egypt, if there is no security, if there is no settlement in the countries, none of those companies will be ready to invest. Why would they invest in one of the countries that are potentially not settled? And we will have just successive sequence of crises. So the first step that I should circulate and state for everyone listening to me, for having a real construction and development, is to have settled security. Otherwise, you would have very limited opportunities. Once again, I welcome you, and I'm happy that you're here on your second home, Egypt. And I hope that if you would have a chance to to see the tangible results and to pay visits to lots of tourism sectors, and also maybe I'm not sure if you have heard about this or not. As you know, the Unified Procurement Authority, the UPA, I actually would like also to say that this was one of the great experiments that we'll leverage from. Let's say that all of the suppliers that we procure from the local or from the abroad markets, specifically in pharmaceuticals, to have an authority dedicated for this. If we would apply the same for all of other sectors, and believe me that the revenue that such authority can provide, the accessories or the suppliers, whether medical or not, they would get the best conditions. If we would be able to apply this on continental level, we will be on a totally different sphere. And the cost for drugs and getting drugs in Africa, I wouldn't be exaggerating once again, that it's around 30 to 50% from the comparing to the cost of procuring these drugs from elsewhere. So again, this is our experience, and we announce it to you. And again, I would like to congratulate you that you have got the WHO for the further merit. And again, you're most welcome. Thank you for attentive listening.
في نهاية هذا المؤتمر
By the end of this session, we ask Almighty Lord to have to reap the fruits and to have tangible results by every African continental country, and we would like to pay tribute to all of the organizers of the XCon. And now, His Excellency President Fattah al-Sisi will start his field visit in the medical suppliers and appliances.
وهكذا سيداتي وسادتي أعلن السيد الرئيس عبد الفتاح
His Excellency President Fattah al-Sisi has announced his gratitude and appreciation to the African brothers and Egypt to grant for 30 million vaccine samples to African people from those that's been manufactured in Egypt. Ladies and gentlemen,